Hi, I'm Dr. Janjua. I'm a board certified facial plastic surgeon, and I will be demonstrating the technique of injecting Sculptra, and I hope to pass it on to other physicians and maybe learn from them as well to improve the techniques and our abilities to deliver it effectively to our patients. And usually the first thing that I do with my patients is I have them wash their hands with the regular antibacterial soap and then wash their face and now using a facial wash to get rid of all the makeup and any other stuff that might be on the face to clean the skin effectively. I will do that myself, and after that the photographs and then marking of the face to know exactly how much to inject and in what areas. After I have my patients wash their face, I take pictures, and typically 5 views: frontal of the whole face, 3/4 on both sides, which is turning to the side this way and to this way. And it's important to have it at this angle where from that angle you can see the opposite cheek to make sure there's enough prominence or not, and then completely sideways as well. And those 5 views are essential. When you do that, make sure you do it at the Frankfurt plane, where if you were looking from the side and you draw a line from the tragus, ear, to the lower part of the eyelid, the inferior orbital rim should be a straight line. That's called the Frankfurt horizontal plane. After that, I have the patient sit down quietly. I make sure they're not chewing, they're not talking, and they're neutral position, and their eyes are closed. Otherwise, when you're looking at them closely, they might start smiling, and that distorts their facial expressions. And at that point, I start marking the areas where I think they need to use Sculptra. I will demonstrate that on my face at this time. As you look, you'll see the numbers marked, and that tells me how many cc's I will place. I usually have a 10 cc dilution of Sculptra. I will be using 2 in the cheek on each side, 2 in the chin marionette triangle on each side, and 1 on each side in the alar groove. I am not focusing on the nasolabial groove, but the alar groove right here, because that's where the biggest depression is and the bone loss is, and we need to build that up. And after this time, I usually take pictures again of the patient to document how much I injected, and then I usually have them ice for a minute or two if they have not used EMLA cream. Some of them use EMLA cream an hour before they come, some don't. Icing for a minute or two before the injection definitely makes a huge difference, and that's what I will do to my own face at this time. And I will be mixing 4 cc of lidocaine 2% plain into the Sculptra. 1 to 2 days in advance, I reconstitute Sculptra using 6 cc of bacteriostatic water, and just before injection I add another 4 cc of 2% plain lidocaine, and I shake it well at the time, and then I place it on the table. For injection purposes, I will be using 25 gauge needle, which is 1.5 inch long, and I also have a 27 gauge short needle, 1/2 inch long, for certain areas that I might use. At this point, I usually have patients use a little ice on the face, and that helps against the pain of the needle prick. And the material itself does not hurt since it has lidocaine in it, and it starts numbing up the whole face. So I will go ahead and use ice, just regular ice in a Ziploc bag, for a few minutes, and then we'll start with the injections. It is very important to make sure that your patients have been careful about not using any aspirin, Motrin, or related products, ideally for 2 weeks. No fish oil. Some of the worst bruising I've seen is with fish oil. Also, excessive vitamin E can cause bruising. I advise patients not to consume alcohol for the day before, the day of the procedure, and the day after. And same applies for exercise. No exercise the day before, the day of the procedure, and the day after. Exercise can increase your heart rate and blood pressure, and that can last for a while, and it can increase the chance of bruising. After completion of the icing at this time, I'm ready to inject the patient, and I'm using a 3 cc syringe with a 25 gauge 1.5 inch long needle, and you have to make sure that there are no bubbles. The clogging happens from bubbles usually entrapped in the methyl cellulose, which is part of Sculptra. So at this point you can see this free flow of the material, so there's no problem at all, and I will start the injection technique. I will use my assistant to show me the mirror at this level so I can see much better. You could bring it kindly a little closer, right there. Thank you very much. So the skin has been already numbed up a little bit, so I pinch and I inject at the same time. This way you really don't feel it going. It's called lateral inhibition, because you're tricking the skin to make it feel like there's nothing there. And you have to be deep. And immediately after you finish, you have to apply pressure. That is very helpful in reducing the incidence of bruising. That is critical. I usually have my assistant hold the pressure for about 3 minutes in each area as we go along with some gauze on it, and that's exactly what we will do at this time as well. At this point I've done the left cheek 2 cc, so I'll be doing the right side, and I've been doing icing on it, and again making sure there are no bubbles coming out, and I'm going to have my assistant help me, and I'm going to tell you exactly right there. And pinching the skin helps to get in there so you really don't feel, you trick the skin. And as soon as you come out, you have to apply pressure. When we inject it mixed with lidocaine, you get some numbness of the infraorbital nerve area and the zygomaticofacial and zygomaticotemporal at times. It can make your eyelids feel strange, where you notice that maybe you can't blink, or just a strange sensation. It can be very annoying for patients, so you have to make them aware that it is normal and it will disappear. It takes maybe 20 minutes to go away. During the time, they have to make sure they do not rub their eyes. So at this time we will take a little break, and I will ice the other locations, and then I will switch to a smaller needle. Where I need to do depot injections in the face, I can use a 27 gauge needle, and it's 1/2 inch long, and it does not hurt as much, and it makes it more of a pleasant experience in the alar groove and the chin marionette triangle area. So I have used ice in the alar groove area as well, and I've switched the needle to a smaller one. This is 27 gauge, 1/2 inch long, made by a company which gives it bigger inner lumen, makes it easier for the material to float, never gets clogged with this one. So it goes easily, and now I'll go for the alar groove, 1 cc each. Can bring it a little closer, please? A little closer, please. In the alar groove area, there's not much room for stretching of the skin, so where you inject, it can be painful. So you have to inject slowly. And also, this is the area where you can sometimes end up in the angular artery, and you don't want to inject it. So always try to draw back to make sure you don't get a flush. If you get a flush, do not inject, come back. That's exactly what you need to do. And now we are left with only 2 areas, the chin marionette triangle. And there's a lot of bone loss here, so I'm using 2 cc's on each side. And I'm going to hold pressure, then ice, and then finish over there. So at this point I've injected my cheeks, the alar grooves. My eyes are feeling better. The eyes are not really as funky feeling as they did earlier. And both right and left upper lip are numb from the lidocaine. And now I'll be going for the pre-gel sulcus, or the chin marionette triangle. So if you could come in closer, please. And I've used ice while I was off the camera to make sure it's nice and numb. And immediate pressure will help against any bruising. Thank you. This finishes the injections on the face. At this point, usually I have my assistant hold pressure all over the face for about 2 to 3 minutes. And although I am sitting upright, I have the patient in a beach chair position because that's the most comfortable. Comfort is very important to reduce the risk of oozing and also to make it a pleasant experience for the patient. I always have light classical music playing in the background, minimize any extra noise. And in cases of very anxious patients, I sometimes prescribe them a small dose of Xanax as well and have somebody drive them so they can feel relaxed. After 3 minutes of pressure, we have patients ice all over for another 3 minutes, and after that massage the whole face. I will ice my face for another 3 minutes, and after that I will demonstrate the massage. So at this point I've done 3 minutes of icing on the face and I'm ready for the massage. I usually have my assistant massage the patient's face with some moisturizer. We typically use bacitracin on the face and massage in a circular fashion, quite hard and deep all over. And the purpose is to disperse the material for an even distribution of Sculptra particles all around, and that minimizes the risk of having a clump of Sculptra sitting in one area, which can lead to a nodule formation. And we will demonstrate at this point how the massage is done. It takes maybe 2 minutes, and it also helps the patient figure out how to massage at home, since they have to massage at home about 5 times a day, 5 minutes each time for 5 days. Thank you. So at this point the injection is complete, and I can tell you that I am feeling very comfortable. Maybe mild soreness at the most, but nothing else, and little shiny areas because of the bacitracin. I'm going to wipe it off, and as you can see, it truly is a no downtime procedure where I'm ready to start seeing patients in maybe like 10-15 minutes. And that's the beauty of the product, that if you follow the precautions, the proper technique, you can really make it a no downtime procedure with minimal discomfort. And I intend to do a whole series and then see the results of Sculptra on my own face. I hope it was helpful to you, and it was reassuring as well. And one more thing you should tell your patients is that the product being poly-L-lactic acid will break down into lactic acid, and lactic acid causes discomfort or soreness in the muscles and the tissues, very similar to when we run or exercise and we produce lactic acid in our muscles, and the next day we are sore. That's from lactic acid. Same principle. And they can take Tylenol for it, but not Motrin or Aleve or anything else. And remind them of the massage, and then have them come back in a month for the next treatment. I hope I have answered most of the questions. I'm always available to my colleagues for any questions they might have. You can email me at janjuafacialsurgery@gmail.com, or you can call us at our toll-free number. It is 1-877-JANJUA-1. The take-home message for me is to use ice immediately before injecting, because even not using EMLA, ice did the trick, and it was not a bad experience at all. So have a wonderful day, and thank you for your time and attention.